Sexually transmitted diseases are caused by sexually transmitted infections. They are spread mainly by sexual contact. STIs are caused by bacteria, viruses, or parasites. A sexually transmitted infection may pass from person to person in blood, semen, or vaginal and other bodily fluids. Sometimes, sexually transmitted infections are spread in ways other than sexual contact. For example, STIs can spread to infants during pregnancy or childbirth. STIs also can spread through blood transfusion or shared needles. STIs don't always cause symptoms. A person can get sexually transmitted infections from another person who seems healthy and may not even know they have an infection. Symptoms. STDs have a range of symptoms, including no symptoms. That's why sexually transmitted infections may go unnoticed until a person has complication or a partner is diagnosed. Here are some of the symptoms of STI. Sores or bumps on the genitals or in the oral or rectal area. Painful or burning urination. Discharge from the penis. Unusual or odorous vaginal discharge. Unusual vaginal bleeding. Pain during sex. Sore and swollen lymph nodes, particularly in the groin, but sometimes more widespread. Lower abdominal pain. Fever and rash over the trunk, hands, or feet. Sexually transmitted infection symptoms may appear a few days after exposure, but it takes years before you have a noticeable problems depending on what's causing the STI. When to see a doctor. See a healthcare professional immediately if you are sexually active and may have been exposed to a sexually transmitted infection. 2. If you have symptoms of sexually transmitted infection. Now, to the causes of sexually transmitted diseases. Sexually transmitted infections can be caused by 1. Bacteria. Gonorrhea, syphilis, and chlamydia are examples of STDs that are caused by bacteria. 2. Parasites. Trichomoniasis is an STD caused by a parasite. 3. Viruses. STDs caused by viruses include human papilloma virus, the herpes simplex virus, and the human immunodeficiency virus, which causes AIDS. Now, the risk factors. Anyone who is sexually active risks getting or spreading an STD. Factors that may increase the risk of getting an sexually transmitted infections include 1. Having unprotected sex. Vaginal or anal sex with an infected partner who isn't wearing a condom increases the risk of getting an STD. Condoms made from natural membranes aren't recommended because they are not effective at preventing some STIs. Not using condoms properly or not using them each time also can increase risk. Oral sex may be less risky, but sexually transmitted infections can still spread if a person doesn't use a condom or a dental dam. 2. Having sexual contact with many partners. The more people you have sexual activity with, the greater your risk. 3. Having a history of STIs. Having one sexually transmitted infection makes it much easier for another STI to take hold. 4. Being forced to engage in sexual activity. See a healthcare professional as soon as possible to get screening, treatment, and emotional support. 5. Misuse of alcohol or use of recreational drugs. Substance misuse can inhibit your judgment, making you more willing to take part in risky behaviors. 6. Injecting drugs. Sharing a needle while injecting drugs can spread many serious infections. Examples are human immunodeficiency virus HIV, hepatitis B, and hepatitis C. 7. Being young. People aged 15 to 20 report high levels of STIs compared to those who are older. Spread from mothers to infants. During pregnancy or delivery, some sexually transmitted infections can be passed from mother to infant. Examples are gonorrhea, chlamydia, HIV, and syphilis. STIs in infants can cause serious problems or even death. All pregnant women should be screened for STI infections and treated as needed. Complications. Many people in the early stages of an STD have no symptoms. That's why screening is important to prevent complications. Possible complications of sexually transmitted infections include pelvic pain, pregnancy complications, eye inflammation, arthritis, pelvic inflammatory disease, infertility, heart disease, and certain cancers such as HPV-associated cervical and rectal cancers. Now, to the most important point of this presentation, the prevention. There are many ways to avoid or lower your risk of getting an STD. 1. Avoid sex or sexual activity. The most effective way to avoid STDs is to not have sex. 2. Stay with one uninfected partner. Staying in a long-term relationship in which both people have sex only with each other and neither partner is infected can be one way to avoid an STD. 3. Wait and test. Avoid vaginal and anal sex or sexual activity with a new partner until you have both been tested for sexually transmitted infections. Oral sex may be less risky, but STIs can still spread if a person doesn't use a condom or a dental dam. These barriers prevent skin-to-skin contact between the oral and genital mucous membrane. 4. Get vaccinated. Getting vaccinated before having sex can prevent certain types of sexually transmitted infections. Vaccines are available to prevent STDs caused by human papillomavirus, hepatitis A, and hepatitis B. 5. Use condoms and dental dams consistently and correctly. Use a new latex or polyurethane condom or dental dam for each sex act, whether oral, vaginal, or anal. Never use an oil-based lubricant such as petroleum jelly with a latex condom or dental dam. Also, these types of barriers give less protection for STDs involving exposed genital sources such as HPV or herpes. Non-barrier forms of contraceptions such as birth control pills or intrauterine devices IUDs don't protect against STIs. 6. Don't drink alcohol excessively or use illegal drugs. If you are under the influence of these substances, you are more likely to take sexual risks. 7. Talk to your partner. Before any sexual contact, talk to your partner about practicing safer sex. Be sure you clearly agree on what activities will and won't be okay. Lastly, think about male circumcision. For men, evidence has found that circumcision can help lower the risk of getting HIV from a woman with HIV by as much as 60%. Male circumcision may also help prevent the spread of genital HPV and genital herpes. Thank you for being with me to the end of this video. Kindly subscribe to my YouTube channel if you haven't. Recommend my video to your family and friends if you find it informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference, and don't forget, Kofi loves you. Peace out.